The 26th of March, 1945. On their way to central Germany, US Army units liberate Hadamar, a psychiatric clinic and one of the 6 killing facilities in the Nazi so-called euthanasia program. They come upon catastrophic conditions. Over 500 patients are starved and weakened by systematic neglect and targeted malnutrition. Although the US Army provides medical care and additional rations to the patients, for many, the help is too late. As a result of inadequate care, several of them die in the days and weeks following the liberation. The US Army launches an investigation immediately after the liberation, and the key members of the hospital management that are still on site are taken into custody and interrogated. Among the staff arrested by the Americans is the deputy head nurse in the hospital. His name is Karl Willig. Karl Willig was born in 1894 in the town of Greveneck, then part of the German Empire. Between 1930 and 1933, the mood in Germany was grim. The worldwide economic depression had hit the country hard, and millions of people were out of work. To the discontent of the unemployed, millions of others joined in, who linked the depression to Germany's national humiliation after defeat in World War I. Many Germans perceived the parliamentary government coalition as weak and unable to alleviate the economic crisis. Widespread economic misery, fear, and a perception of worse times to come, as well as anger and impatience with the apparent failure of the government to manage the crisis, offered fertile ground for the rise of Adolf Hitler and his Nazi party, which Karl Willig, whom one of his co-workers later described as a fanatical National Socialist, joined in 1932. On the 30th of January 1933, Adolf Hitler was appointed Chancellor of Germany by President Paul von Hindenburg. Many of Nazi Germany's racial policies were shaped by theories of eugenics, or racial hygiene, which was a scientific movement of the late 19th and early 20th centuries that aimed to improve the genetic quality of the human population. Medical professionals implemented many of these policies and targeted individuals the Nazis defined as hereditarily ill, those with mental, physical, or social disabilities. The Nazis claimed that these individuals placed both a genetic and a financial burden upon the society and state. Nazi authorities resolved to intervene in the reproductive capacities of persons classified as hereditarily ill. One of the first eugenic measures they initiated was the 1933 Law for the Prevention of Offspring with Hereditary Diseases, which was known as the Hereditary Health Law. The law mandated forcible sterilization for 9 disabilities and disorders, including schizophrenia. As a result of the law, 400,000 Germans were ultimately sterilized in Nazi Germany. Along with the law, Adolf Hitler personally decriminalized abortion in cases where fetuses had racial or hereditary defects, as determined by doctors, while the abortion of healthy, pure German Aryan unborn remained strictly forbidden. In addition, eugenic beliefs shaped Germany's 1935 marital hygiene law, which was a law that prohibited the marriage of persons with diseased, inferior, or dangerous genetic material to healthy German Aryans. Eugenics not only provided the basis for the Nazi compulsory sterilization policy, but it also underpinned the murder of the institutionalized disabled in the clandestine euthanasia program. The euthanasia program, the systematic murder of institutionalized patients with disabilities in Germany, started in 1939, about 2 years before the Nazis began systematically murdering Europe's Jews as part of the final solution. The program was one of many radical eugenic measures which aimed to restore the racial integrity of the German nation. It aimed to eliminate what eugenicists and their supporters considered life unworthy of life. Those individuals who they believed, because of severe psychiatric, neurological, or physical disabilities, represented both a genetic and financial burden on German society and state. Nazi propaganda falsely portrayed these mass murders as euthanasia or mercy deaths. In the spring and summer months of 1939, a number of planners began to organize a secret killing operation targeting disabled children. The Second World War began on the 1st of September 1939, and euthanasia planners quickly envisioned extending the killing program to adult disabled patients living in institutional settings. In the autumn of 1939, Adolf Hitler signed a secret authorization in order to protect participating physicians, medical staff, and administrators from prosecution. This authorization was backdated to the 1st of September 1939 to suggest that the effort was related to wartime measures. The program's functionaries called their secret enterprise T4. According to Hitler's directive, Führer Chancellery Director Philipp Böhler and physician Karl Brandt led the killing operation. Under their leadership, T4 operatives established 6 gassing installations for adults as part of the euthanasia action. One of them was the State Hospital of Hadamar. Founded in 1883 as a correctional institution for released prisoners, Hadamar converted into a mental health facility in 1906. During the early years of the Nazi regime, conditions steadily deteriorated due to overcrowding, poor food rations, and reduced nursing care. In late August 1939, Hadamar ceased operating as a mental health facility and was turned into a military hospital. The following year, in November 1940, it was remodeled for use as a euthanasia facility. Codenamed Anstalt Air, meaning Facility E, Hadamar went into operation as a killing center in mid-January 1941. For the next 8 months, busloads of patients arrived daily at the facility, and a staff of approximately 100 ran the killing operation. After the victims were offloaded, they were ushered into a reception room where they were weighed and photographed before being led to the gas chamber, disguised as a shower room in the cellar of the institute. Pure bottled carbon monoxide gas was used. T4 functionaries burnt the bodies in crematoria attached to the gassing facilities. Other workers took the ashes of the cremated victims from a common pile and placed them in urns to send to the relatives of the victims. The families or guardians of the victims received such an urn, along with a death certificate and other documentation listing a fictitious cause and date of death. Between January and August 1941, some 10,000 institutionalized mentally and physically disabled persons had been gassed there under the auspices of Operation T4. Since July 1941, Karl Willig started to work in Hadamar as an orderly and then as a deputy head nurse. When in the summer of 1941 the staff celebrated the cremation of their 10,000th patient, they celebrated with beer and wine. Since the crematorium ovens were often filled with 2 corpses at a time, the cremation process was less than perfect, which often resulted in a thick, acrid smog that hung over the town. Murderous operations were temporarily halted in August 1941, but they were reinstated in the following summer of 1942, and the Hadamar medical personnel again began to murder disabled patients. From 1942 until the end of the war in May 1945, the facility claimed the lives of an additional 4,400 victims by lethal overdoses of medication. Willig, together with other nurses and chief physician Adolf Wahlmann, had been involved in the selection and killing of the victims by overdoses of medicine or food deprivation in the institution. The victims included German patients with disabilities, mentally disoriented elderly persons from bombed-out areas, half-Jewish children from welfare institutions, psychologically and physically disabled forced laborers and their children, German soldiers, and foreign Waffen-SS soldiers deemed psychologically incurable. Karl Willig was regarded as a particularly brutal caregiver who also abused patients. As he admitted after the war, he worked in Hadamar of his own free will. No one ever threatened him with a concentration camp if he lost his work at Hadamar. He had no other job anywhere else, and he never tried to get himself fired. Only once he asked to be transferred to another facility, but the request was denied. He later explained that the reason he chose to become a mass murderer was that he would have lost his pension if he had left his job. The victims in Hadamar included not only German citizens, but also people of other nationalities. Before the Poles and Russians came to Hadamar the first time, all the male employees, including Karl Willig, were called together, and Chief Administrator Alfons Klein told them that foreign workers with tuberculosis were coming there in trucks and that they had to be liquidated. After this, there was a transport of Russians and Poles from the nearby town of Limburg under Lahn, coming in 2 loads. Willig was the one who went to Limburg to accompany the second load. All the people from the first load had been given injections and veronal or chloral to drink and were asleep when Willig came back with the second load. The same was done with the people of the second load. Willig gave them sedatives to drink. The next morning, the Hadamar chief physician and medical director, Adolf Wahlmann, came and examined the Poles and Russians after they were dead. The euthanasia program continued until the last days of World War II, including a wide range of victims, geriatric patients, bombing victims, and foreign forced laborers. Historians estimate that the euthanasia program in all its phases claimed the lives of 250,000 individuals. In March 1945, the US Army liberated Hadamar and Willig was taken into custody. American authorities were initially eager to try Hadamar physicians, nurses, and bureaucratic staff in their custody for the murders of the nearly 15,000 German patients killed at the institution, but quickly discovered that they had no jurisdiction to do so under international law. US military officials could not try German nationals for murdering their fellow citizens. American prosecutors, however, found a loophole. 476 Soviet and Polish forced laborers suffering from tuberculosis who had been sent to their deaths at the facility in the last months of the war. As these civilian forced laborers were citizens of countries allied to the United States, American prosecutors were able to open proceedings against 7 Hadamar defendants associated with the murders of the Eastern workers. On the 15th of October 1945, Chief Prosecutor Leon Jaworski, who had gained fame in the 1970s as the Watergate Special Prosecutor, won convictions for all of the accused. The 6-man US military tribunal prescribed death by hanging for Hadamar Chief Administrator Alfons Klein and 2 male nurses, Heinrich Ruoff and Karl Willig. On the 14th of March 1946, they went to the gallows. As he was led to his execution, Karl Willig, who had personally killed hundreds, if not thousands of people at Hadamar, said, "I did my duty as a German official. God is my witness." Willig was 51 or 52 years old when he was executed by hanging in Bruchsal prison. There were no tears shed for Karl Willig. Thanks for watching the World History Channel. Be sure to like and subscribe, and click the bell notification icon so you don't miss our next episodes. We thank you, and we'll see you next time on the channel.